Just let everyone know we've started recording, so if anyone asks any questions, you will be recorded in the course of the presentation. So again, thank you very much. We're going to get started now. And there we go. So a little bit about the Long-Term Care Coalition and about me. I think most of the people on the line probably know who we are, but just in case, we are a nonprofit organization. We are completely dedicated to improving care and quality of life for nursing home residents and assisted living residents. We do mostly systemic advocacy, but we've also been doing more and more trainings for nursing home residents and family members and ombudsmen. And that's something about which I am really excited, and I hope that we'll get some of that across today, because I do think it is incredibly valuable for families and residents and ombudsmen and advocates, including attorneys, geriatric care managers, people with the organizations, et cetera, to be aware of what is going on and to be equipped to advocate effectively for themselves. Lastly, again, my name is Richard Mollett. There's a picture of me in the lower right-hand corner. I joined LTCCC 15 years ago, and I've been the executive director since 2005. And just one last sound check. Sarah, everyone can hear okay?
There's a little background noise. It seems to be coming from one place. If those of you who are on the phone, please go *6 to mute your phone.
Great, thank you. Yes, I think that helps. Sarah, is that okay? Can you hear me okay?
I can hear you fine.
Great, great. So what we're going to do today is two things. One, I wanted to give a background of what the nursing home system is, how it works, what the nursing home reform law is, and what the promise of the reform law is, and then also start talking about what is going on now with the nursing home standards, the changes that are happening on the federal level, and our project that we're going to be working on, as I mentioned just a moment ago. We are really excited to be able to do this educational work. We have funding from the New York Health Foundation to a project for the next year, which we hope to continue in the future, to really focus on educating and equipping family members, ombudsmen, residents, and people who work with them to be as effective advocates as possible for their own care. So if whoever the phone's ringing, if you could either mute that or mute your phone, please. Again, it's *6. So a bit about the nursing home system, and again, I just thought it was important to give a background. I know many of you know it, but I think many of you may not know it as well, and I know for me it's always worth it to have a refresher. In a nutshell, as I put here with a little walnut at the bottom, the vast majority, almost every nursing home in the country, and all except I think 2 in New York, participate in Medicaid or Medicare. That means that they take Medicare or Medicaid funds for one or more of their residents. In order to, as they call it, participate in Medicaid or Medicare, the facility agrees to meet standards provided for in federal law. Now, states can have additional protections to what the federal requirements are, but they can't have less protections. So by that I mean, like, for instance, many states have minimum staffing requirements for their nursing homes. They require that nursing homes have a certain number of CNAs and RNs and LPNs on their staff. New York is one of the minority of states that does not require that. And that is not required in a set number by federal standards as well. And then lastly, and this is important, the federal protections that we talk about apply to every single resident in a licensed facility. So whether your care is paid for by Medicaid, Medicare, private pay, private insurance, you're out of pocket, etc., it doesn't matter. Every standard that we talk about today, and anytime, anything you see on our website, it's all the same no matter who pays for your care. So the nursing home reform law, I actually have a video for some reason that showed up in the background. Let me just click on that. I don't know if anyone else can see that, but I can. I'm just going to pick it up. Okay. So the nursing home reform law in 1987, I don't know if any of you are old enough to remember, but I remember visiting my great-grandmother in a nursing home in Rockaway in the in the early 80s, and the conditions were pretty bad. And what happened in the late 70s, early 80s is that there were a lot of scandals in nursing homes. And as a result of those scandals, the federal government did a study on nursing home and nursing home care. And the result of that study was that there really needed to be improvement and stronger standards to protect residents. And out of that came what we call the Nursing Home Reform Law, or OBRA 87. I just got a message from Sarah, just an aside, that we're getting some feedback. So I would ask if you could please unmute your phone. That would be great. And I think part of that might be coming from me, and so I apologize. In any case, moving right along, so the nursing home reform law requires that every resident, as I mentioned before, no matter who pays for your care, is provided with the services to attain and maintain his or her highest practicable physical, emotional, and social well-being. And that's really important. It's what we pay for. It's what every nursing home agrees to provide when they accept Medicaid or Medicare or participate in Medicaid or Medicare. And certainly it's what every resident deserves. And I thought from when I started working in this field 15 plus years ago that whose mother would it be okay not to have good care? Or whose loved one would it be okay to not have good care? And I think everyone would answer, not me, not my mom, not someone I care for, but too often we accept poor care as a matter of course. I'm just going to stop for a second. Sarah, is the feedback still coming on?
Yes, there's still feedback coming on. Those of you who are on a computer, above the slides, there's a microphone. It's next to the phone and the video camera, there's a microphone. If you click on that, you will unmute yourself. You will mute yourself, sorry. And then you can click again to unmute.
And a camera.
Say it again. Okay, we're going to move on, and we'll work on this as well. I apologize for any feedback that anyone's getting. In the future, actually, what I could try to do is I could try to mute everybody, which is not my favorite thing, but we'll do that right away. Hold on one second. Okay, sorry about that, folks. There we go. So I'm going to mute everybody. So hopefully you can see me more clearly, and I will open it up again in a little bit. So I just want to talk a bit about the reform law. It really, what the reform law says to me is that everyone who the nursing home accepts is entitled to receive the care and the services that he or she needs to attain and maintain his or her highest practicable well-being. And I know that that is a mouthful, and those of you who have participated in earlier programs that I've done, I often say that it's a mouthful, but it's really important. What highest practicable means is that if you go into a nursing home and you could walk down to, you could get out of bed and walk to your bathroom with someone assisting you, that the nursing home is supposed to be providing that level of assistance. They are not supposed to be saying, oh, we don't have enough staff on hand now to provide that level of care. If you come in and you have a propensity to develop pressure ulcers, which is a serious problem for those of you who are in or have a loved one in a nursing home or are an ombudsman in the nursing home, you'll know almost 1 out of 10 people in New York State nursing homes have a pressure ulcer. When someone comes in with a pressure ulcer, it is up to the facility to be doing regular monitoring to ensure, and treatment, to make sure that you get the care that you need to avoid pressure ulcers as much as possible, to address them right away. And I've experienced this as a family member in last year, actually. And I know that this is something that a lot of people experience, that they don't get that care, and that pressure ulcers develop. Now, on occasion, it is possible for someone to develop a pressure ulcer quickly, but most of the time what I see when I see deficient care and going on in the facility is that they knew the pressure ulcer was there, and they didn't do the monitoring, they didn't do the turning and the repositioning that that person needed. So it's really important for all of us as advocates, whether we're a resident, a loved one, an ombudsman, an attorney, etc., to know that this is what we have a right to expect. This is what the nursing home contracts to provide. And really what we want to do for my organization, and what I want to help you all to do, is to be better equipped to realize that. Because I know when I speak to family members, when I speak to ombudsmen, quite often that's not what they see when they are in a nursing home. But we want to make that a reality. And I honestly believe that if we don't know what our rights are, if we don't know what we have a right to expect, then it's very hard to, probably impossible to make that a reality. And we'll move on to the next slide for those of you who are following by phone. So the question is, if nursing home, if the nursing home reform law is so great, if it does provide for this level of care, why are so many nursing homes bad places to live and to get care? And what that really comes down to, especially from our perspective, is that even though the law is strong and the standards are good, if they're not enforced, it does not make a difference. So that is really important. So what do we get at? And this is something that my organization focuses on a lot. For those of you who are familiar with us, is that we look at what's going on with enforcement. How can we improve so when the Department of Health goes in, they better site facilities. They site facilities better, excuse me. And this is why, as I mentioned before, we're focusing a lot on educating families and residents and people who work with them, because I honestly believe that if you know what your rights are, then you can speak out for them effectively, or you can make a difference, especially when the state or the federal government isn't doing that. What I wanted to do also, and this is really just to lay the groundwork for what we're going to talk about, and I hope you'll join us in the coming months, that there were different agencies that are responsible for overseeing nursing home care. Now, CMS, the Centers for Medicare and Medicaid Services, that's the federal agency. They pay for all Medicare and Medicaid services, and they also are the ones that develop the regulations and are responsible for ensuring that every resident receives the care and the services that he or she needs. CMS contracts with the state agencies. In New York State, that's the New York State Department of Health. And so the Department of Health has a contract with CMS, and they are responsible for monitoring care. Those of you who are familiar with DOH and with how, with nursing home care, you know that you can make a complaint to DOH. And DOH comes in about once a year to do what's called a survey, or an inspection of a facility. But in actuality, and this is really important, it's DOH's responsibility to ensure that residents are safe, treated with dignity, and receive the appropriate services 24 hours a day, 7 days a week, 365 days out of the year. And the reason why I say that is because it's called 24-hour skilled nursing care. People are in a nursing home because by definition, they need that skilled monitoring. They need that oversight of their services and arrangement of their services. And that's what's supposed to be going on. And that quality level is supposed to be there every single day. As many of you know, and this is something that's long been an issue for the Long-Term Care Coalition, CMS and DOH often don't do a great job in overseeing care and identifying problems and making sure that facilities learn how to overcome their problems quickly so that people aren't harmed year in and year out, day in and day out. So what we often do is we go to other agencies, and I wanted to give the names of a few of them here. One is the New York State Medicaid Fraud Control Unit, MFCU, that is housed in the New York State Attorney General's office. It's essentially a federal program and a Medicaid Fraud Control Unit. It operates in every state except for North Dakota. But the Medicaid Fraud Control Unit goes in and they look at facilities to see whether they are spending money, not spending money publicly, but whether they're taking in government funds for Medicaid or Medicare, whether those funds are being used appropriately. And what the New York State Medicaid Fraud Control Unit has done, and this is unusual among the states, is that they have held nursing homes accountable for taking in money but failing to meet the standards of care that are so important. So that is really pretty innovative, and that's something really good as far as we're concerned. On the negative side, as far as the Medicaid Fraud Control Unit is concerned, is they don't have the regulatory authority that the Department of Health or that CMS has. So just to backtrack, you have CMS and DOH, which are responsible for ensuring care and decent quality of life with dignity for every resident in the facility, 24 hours a day, 7 days a week, every day of the year. The MFUCU, the Medicaid Fraud Control Unit, they don't have that kind of capacity. So they do, a certain number of investigations throughout the year. They do a great job. They really go in and do a very strong investigation, and we publish, a lot of their work. But they don't have the ability to go into every nursing home and to oversee care every single day. So that's important for people to know. In addition, there is the New York State Comptroller's Office and the New York State Office of the Medicaid Inspector General. And what types of work that they do is more, generally speaking, in terms of audit. So they will look and see whether, based upon an audit, financial records, whether certain services were provided or not. And they'll look to see if the billing matches up with what is promised in terms of care and things like that. So they have less of a capacity to oversee care, but because they tend to be very directed and very strong, like the Medicaid Fraud Control Unit, they can be powerful advocates for good nursing home care and for nursing home improvement. So essentially what you have here, so I just wanted to give a quick diagram. Again, you have CMS that pays for care, pays for the majority of care through Medicaid and Medicare programs, and it's also responsible for quality assurance. CMS contracts with the New York State Department of Health. New York State Department of Health in turn oversees nursing homes, and it's the nursing homes that are providing care to residents. So that's, in a nutshell, how the system is supposed to work. In addition, and I know we have many ombudsmen on the line, there's the Long-Term Care Ombudsman Program. Now, Long-Term Care Ombudsman, many of you are either ombudsman or you're hopefully familiar with the ombudsman, in your nursing home. We hope that the ombudsmen are there, on a regular basis, hopefully once a week, to really see what's going on in the nursing home, to monitor care, to educate residents about their rights, and to help them realize those rights. Now, ombudsmen, and the reason why I listed them separately from the other entities is they don't have regulatory authority. So ombudsmen cannot penalize a facility the way DOH can, or the way the Medicaid Inspector General, the Medicaid Fraud Control Unit can. They can penalize the facility. Ombudsmen cannot do that. But they are critically important as far as we're concerned, because they are the only ones that are there on a regular basis, and they are really the only ones, in my view, that provide a regular voice for residents. And many residents are lucky and they have family members. Many of the family members, and again, I've been a family member myself, we know how frustrating it can be when there's a problem and trying to deal with it. The ombudsmen are really the ones that can help us, I think, are on the front lines in terms of helping people to work out their problems and to advocate for better care. So my hats are always off to the ombudsman programs and to the people who run them and the people who volunteer for them. It's really a important and incredibly valuable work. So just to step back for a moment, what we've discussed so far is the reform law, how the nursing home reform law is the basis for all care in every licensed nursing home in the country. We've talked about some of the oversight agencies and the long-term care ombudsman program. What I want to go on to next is how do we overcome some of the challenges that exist to achieving good care and quality of life, and how can we strengthen that foundation to achieve the promises of the nursing reform law: good care, with sufficient staffing and sufficient, good and sufficient services, people living with dignity and having a good quality of life. So essentially, when I thought about, putting together this program and thinking about it, we have certain steps to quality. We have the law, which is the foundation. We have the regulations, which are the standards that come out of the law. And then we have the guidelines. And the guidelines are basically what CMS puts in writing for the Department of Health, for nursing homes, and for advocates to say, you know what, this is what we expect to see when we come into a nursing home. And putting those together is really how you get to quality care. But all of it is really predicated on having the enforcement. As I said before, if the laws are so good, why is care often so bad? It's because we don't have the enforcement. We don't have quite often the reality of that promise. So how do we get there? What I want to do in this slide is really show you where we are and where we're going. So as I mentioned before in the first orange tab on the left, 1987 we saw the Nursing Home Reform Law. So that was a result of the very scandalous conditions that existed in the late 70s and early 80s as Medicaid and Medicare came on board and they were paying for more care. We saw more and more providers that came in and they were really looking to make money, less of the so-called mom and pop places that were maybe hoping to provide good care, but when it became a major industry, I should say, through Medicaid and Medicare, is when we saw some of the care go downhill. So the 1987 Reform Law was a response to that. In 1991, the regulations, those standards came out, which realized the Reform Law. And those are the standards that we talked about that assure that every resident receives the quality of care and quality of life, good pressure ulcer care, decent food, a home-like environment, all the things that we don't always see, but we know that that's the promise of nursing home care. So that came out in 1991, a little over 25 years ago. In 2014, CMS, at the green tab, CMS announced plans to revise regulations. So the regulations have, in essence, never changed since 1991 until the end of last year. So in 2014, CMS announced that it was revising regulations. They issued draft regulations in 2015. We commented on those drafts. Other groups commented on those drafts. Many providers commented on those drafts. Finally, in October of 2016, a few months ago, CMS published new regulations. So it's really for the first time, there have been some tweaks to the regulations over the years, over the past 25 plus years, but no real substantial change for 25 years until last year. In October 2016, they published new regulations. And those regulations are going out in 3 phases. Those are the last 3 tabs on this page. So in November 2016, they started phase 1 implementation. These were basically the standards that mostly did not change too much from what existed before. This coming November will be phase 2. Those are some of the bigger changes that are taking place. And then in November of 2019 will be phase 3, the final phase of implementation of the regulations. So this, in essence, gives you the whole timeline of what we're talking about, from 1987 up into the present over the next couple of years. And that's why we're doing this project again, is because the regulations are all changing. So what exactly is changing? As I said, all the regulations, for 25 years, everyone has known what the rules were and where to find them. That whole structure is changing. It's major. All of the guidelines are changing. So the federal government has issued over the years extensive guidelines about how they want every standard to be put in place. So when we talk about pressure ulcers, there's standards for when a nursing home is supposed to be monitoring, what it's supposed to be doing to alleviate pressure ulcers, what the standards of care are, and what the states are expected to be looking for. All that has changed. It's all being revised right now. In addition, all of the F-tags have changed. So when a surveyor, an inspector goes into a nursing home, they look at the regulation, and for each regulatory standard, there is what's called an F-tag. So F222, for instance, is a prohibition against the use of chemical restraints like antipsychotic drugs. Those of you who know our work know that's a very big issue for us. the overuse or inappropriate use of antipsychotics. So if a nursing home, if a surveyor goes in, into a nursing home now, he or she knows that, if they identify that there's inappropriate use of antipsychotic drugs to restrain a resident, for instance, if a resident has dementia and she's acting out in some way that might be disturbing, too often nursing homes will use antipsychotic drugs rather than trying other ways to calm the resident or distract the resident or alleviate the resident's upset. Right now, that surveyor, and for the past 25 years, that surveyor could say, okay, I know that's F222, very easy for me to plug in and very easy for me, in a sense, to know what I need to do. All that's changing. All the old numbers are going to be gone over the next few months. CMS is issuing all new numbers. So why do I have this baby's face, are you serious, on the side? Because with the changes in the regulation, the changes in the guidelines, the changes in the F tags, all this is changing. So if for those of us who have been concerned that, I speak to families and they say, the state comes in here, the surveyors come in here and they don't see any problems, they don't identify any problems. Well, that is likely to get worse because they already, in the past, they knew what the numbers were, they knew what the regulatory language was, etc., and it was easy for them, in a sense, to reference, if not to actually do the citations. Now it's going to be even more difficult. So this is why one of the reasons why we think this project is so essential is because if they don't know, who's going to know? And one example that I wanted to tell you all about was as I mentioned, in 2015, CMS issued draft regulations, and they accepted comments from providers, from groups like ours. They received over 9,000 comments from different people and organizations. And over again in the comments, people were saying, these are nursing homes, the industry was saying, we know that we see that you're now going to require that a resident can choose her own physician. We don't think that's fair. We think that's an unfair requirement. Well, in actuality, surprise, surprise, that requirement has been in place since 1991. So the reason why I think it's so important to mention that is because this is a requirement that has been in place for over 25 years, and the nursing homes were not even aware of it. And I know many family members that I have spoken to have told me that they don't feel they have the right to choose a doctor. Residents who tell me they don't feel they have the right to choose a doctor. The nursing home is telling them they don't, when in fact they do. And so that is one of the things. It's a lot of these things are really tough to know about. But if you don't know about them, you can never advocate for them. But this, to me, was such a striking example that the nursing home industry clearly did not know an important standard that has been in place for over 25 years. And not only did they not know, but it was obvious to me that the state surveyors in New York and elsewhere didn't know either, because no one was ever saying, hey, you're violating the standard by not letting a resident choose her own physician. So that is just one very easy example, but it really shows to me why we are going to have to be as aware and as vigilant as possible when it comes to the rights and that we have as residents and as resident advocates. So as I said, what can we do? We can be as informed as possible. And I think over the next couple of years, especially, we're going to see a lot of confusion, a great lack of awareness among nursing home staff, among administrators, and among nursing home surveyors. If you call up the Department of Health, they may not know about certain rights, because all of those rights are changing, and they are going to have to be retrained and be able to understand. And I know I speak to a lot of family members who get frustrated when they call up the complaint line, etc. That, I'm afraid, is going to grow. So that's why it's really important for us to have the facts at hand, to have the ability to know what our rights are and how to advocate for them. In addition to us knowing, one of the reasons why we want to do this program is to reach out as much as we can to residents and resident councils, to families and family councils, and to the Ombudsman and other people who are really working for and with nursing home residents, because I think that if we can get to resident councils in the nursing homes across the state, if we can get to the Ombudsman and to the family councils, to the people who talk to nursing home residents, through different helplines, et cetera, that we can equip you all, and equip myself as well, to be smart consumers about our nursing home care and to work effectively. So this is what we're going to do. We're going to be having free monthly training. This is the first one, which is really an introduction. I wanted to give you all, in essence, a lay of the land of what the residents' rights are. But we're going to have these free monthly trainings. Please help us to spread the word. We're happy to send out hard copies. If you give us a call, 212-385-0355, you could speak to Sarah Rosenberg, who is our wonderful office manager. She's also can be emailed, Sarah, S-A-R-A, at L as in Larry, T as in Tom, CCC.org. Anyone that you're working with that is working with residents, families, ombudsmen, we want to alert them to these phone calls and these webinars and to the materials that we're going to be putting out. So each program that we're going to do is going to focus on a couple of standards that we think are relevant to resident care, to resident dignity, and to quality of life. So look, none of us, I'm not expecting anyone to be an expert, and you don't need to be an expert. What we want to do is to equip you with some basic knowledge, and also, as I note here under resources, we're going to have a free handout that's going to go with every single program that'll just be short, that'll cite to the regulations, cite to the law, so you don't have to say, oh, this guy told me 6 months ago about some standard that says that my family member, should have help when she needs to go to the bathroom. You're going to actually have a 1 or 2 page piece of paper that cites the regulation and gives you some hints or a list of things that you can look at to make sure that those rights are being, effectively enjoyed, I should say, by the resident. So we're going to have the free handouts. We're going to have all the presentation materials, on the website. We are now in the process, I hope it'll be released in the next week or so, of redesigning our website, www.nursinghome411.org, and it's going to have a learning center. So right when you go to www.nursinghome411.org, there'll be a learning center that'll be tailored to residents, families, and ombudsmen. And what we'll do for each one of the standards is we'll have a short description on the site, so you can say, oh, if I'm having an issue with dementia care, I can look down the list or do a search for dementia care, get that piece of paper, print it out if you want, and take it with you to the nursing home, take it with you to the family council or the resident council meeting, and use it to better, to really help support your advocacy for better care. We will also be here throughout the year at least to provide technical support for any questions. What that means is that if you have something that you're confused about, if you want me to call into a family or resident council meeting, we will try to arrange whatever we can. We're a small organization, as many of you know, to support your work and your advocacy and your understanding. So just again, in a nutshell, as I said before, many nursing homes are already confused about their old standards as well as the new standards about what they're supposed to be doing. There's going to be challenges, greater challenges for surveyors to identify and cite facilities. So I hear from family members and residents all the time that the surveyors came in, or the surveyors, they made a complaint and it was never substantiated by the survey system. So I'm afraid that's going to become even more serious. It will be up to us to know what our rights are and what rights residents have to expect in every aspect of their care and their services. And it will be us to make sure, again, that the resident councils, the family councils, and the ombudsmen who are in our nursing homes are strong and are equipped to be as effective as possible in speaking for their residents. So our next program will be March 21st at 1 p.m. We are recording all the programs and we'll put them up on the website. We'll always post materials and we'll be happy to distribute after each program. We'll distribute handouts for the previous program. Handouts for the previous program, sorry. and also invites for the next program with the topic that we'll be covering. And I just wanted to leave you all with, we can't fight for our rights if we don't know what they are. And over the years, I've spoken to so many family members and residents and ombudsmen too, who are upset by what they're seeing and what they are experiencing in their nursing home. And when I talk about the reform law, like, what are you talking about? How care is so different. What we see is so different in our nursing home. Well, if we don't know what our rights are, there is no way that we can advocate for them. And if we're worried about nursing homes not knowing what the new standards are, of the Department of Health not being fully aware of what the new standards are, again, it's really going to be up to us to be as equipped as possible to know what our rights are. I think that's it. I'm going to, here again is to sign up, info@ltccc.org or sarah@ltccc.org. Our number is 212-385-0355. Please let us know if you want to sign up for the our listserv to get alerts and materials about future programs. For our newsletter, we do a quarterly newsletter. We never sell names. We never give the names away of people. It's a we're very careful and try to be very respectful of people's time and of their email addresses and any other information that you entrust with us. And you can also join us on Facebook and on Twitter. We try to get some stuff out. And I'm going to open it up for questions, but I thank you all very much. And again, I just can't say enough. I hope that you'll join us. I think it's so important for all of us as residents, families, ombudsmen, and people that care about them to know what is going on with the changes and to be aware and equipped so that we can be as strong advocates as possible. So thank you. I'm going to open up the line. Okay, so I've unmuted if anyone has any questions or comments.
Yes, Richard, this is Janet. Can you hear me?
Hi, Janet. I can.
I just wanted to ask, do you have any plans of talking further about the Ombudsman program? We have some concerns about conflict of interest here in Rochester.
I know you do, but that's not the scope of what we're doing here. What we're doing here is we're very specifically talking about the nursing home standards.
Okay.
And how they are, as I hope I got across, there is a lot going on. I mean,
right.
all the FTAGs are changing, all the guidelines for nursing homes are changing, and many of the regulations are changing, and they're all the language for the regulations are changing.
Okay.
So I think I hope that I got across how critical this is. We are strong supporters of an independent ombudsman program, but that's really, as I hope you know, that's really a separate issue.
Okay.
Are there any questions or comments? Okay. Well, I thank you all for being on the line and for joining us today. Please, again, send an email to info@ltccc.org or call 212-385-0355, and we would be happy to provide you, again, with hard copies in advance as well as electronic copies that you can distribute. So thank you very much, and you all have a nice evening.
Good night.
Bye-bye now.
Thank you.